Hi, my name is Brandon, and I'm an alcoholic and addict in recovery. And today I want to talk about my experience with dual diagnosis. That is, disorders that occur simultaneously and along with substance use disorders. In my situation, the disorders that I have experience with are anxiety, depression, and then maybe bipolar disorder. Jury's still a little out on that one. But I want to talk about the right way to handle these things and the wrong way to handle them, because I've done both. The wrong way to handle them is by being dishonest about anything that's going on related to any of these disorders. And that's what I did in my active addiction. When I used to go to my psychiatrist or my counselor, my goal was to fix the anxiety and depression that I was feeling. I used to have a lot of panic attacks. Anxiety in general was a big part of my life. Depression especially was also something that was kind of cyclical for me. I would go through periods of depression, usually coinciding with periods of stress in life. But I didn't, and I knew I probably shouldn't be drinking or smoking as much pot as I was, but I didn't want to address that. I didn't want to mess with that. I just wanted them to fix the anxiety and depression. And so when I went to see them and they asked me how much I was drinking, how much I was using, I would be dishonest with them and use numbers that I thought were acceptable. The funny thing is, even the numbers I thought were acceptable were not really acceptable to them. Even when I gave them, like, I only have three drinks a day on the weekday and a 6-pack on the weekends each night. My psychiatrist was like, that's drinking a decent amount. You should probably cut down on that. And I thought, wow, if I could just drink that little, I'd be in great shape. So that should have been a sign for me that there was a problem there to be addressed. But the point is that without knowledge of exactly what I was putting in my body, exactly what drugs I was already self-medicating myself with, they could not accurately prescribe drugs to help me or other treatments to help me. I was seeing a therapist at that same time who was trying to train me in cognitive behavioral therapy, how to apply that to some of the anxiety that I had. And that treatment wasn't very effective because he didn't know the kinds of drinking and drugs, the amount of drinking and drugs that I was doing at the time. So that dishonesty doesn't help and really actively hinders the relationship between mental health professionals and the patient, and prevents the patient from getting the kind of help they need. No question. If you go in and you lie to your doctor about the amount of drugs or alcohol you are ingesting, and the reason is because you're worried they may tell you to stop, that's a good sign that you might have a problem. Okay? So the flip side of that is, what's the right way to approach these relationships? And the right way is to be completely and brutally honest. And here's what I found. I've been going to therapy of some shape or form for 30 of the 40 years that I've been alive. And I have never said anything to a therapist or psychologist that surprised them. I have never said anything to a therapist or psychologist that shocked them. And I'm sure that happens. But I have certainly gone into an appointment thinking I was going to shock them, or concerned that if I told them something like the amount that I drank, that they would just be blown away, that they'd never heard of anybody drinking that much. And, I found out very quickly that's just part of the terminal uniqueness that a lot of us addicts experience. I really don't have unique problems. A lot of the problems that I have are the same as many of the people that I sit in meetings with and have met throughout recovery. And so these kinds of things, that worried me about going to a psychologist and telling them all of the truth turned out to be not that big of a deal once I actually just sat down and did it. And after getting honest with someone, only then could I find the right medications to help with the depression, the anxiety that really allowed me to experience life in recovery with much more freedom than I ever did with life prior. It's really important for us as part of recovery to look at mental health as something that is not just done through recovery, but if necessary, done with other medical professionals. And in those relationships, I feel like we've got to be as honest as possible. If there's something that we don't like about the medication we're given, be honest about it. If there's something that we don't like about the person we're seeing, if there's something that we're not jiving with, we got to be honest with ourselves about what's really going on there. Honesty is so important in these relationships, and the extent to which a medical professional can help you get through some of these kinds of issues is really limited by the amount of honesty you're willing to have with them. And if you're willing to be completely open and honest, then there's no reason that someone like a psychiatrist or a counselor or therapist can't help you get through even the most seemingly insurmountable mental health issues. But it really requires a lot of honesty and dedication on the patient side to make that happen. And that's been the difference between my experience in recovery with mental health professionals and prior to recovery. Prior, I just wasn't honest, and I didn't really have much of the follow through that I do now. When I was in my addiction, I would be given homework to practice exercises, things like that I just blew off. And now if my therapist gives me homework to do and says, I want you to practice this meditation every day until you see me again, I'm doing that because I know that this is part of the treatment. And if it doesn't work, then I haven't lost anything except a little bit of time to doing it. And that's okay. And we know that doesn't work, and we move on to the next thing. So that's it for today. Hope you have a good day, and I'll be back here tomorrow with more.